In this video, we're going to talk about pulmonary ventilation, which is inspiration and expiration, so moving the air from the exterior environment into the lungs and moving air from the lungs back out into the exterior environment. Things you want to remember about pulmonary ventilation is that this all depends on volume changes, pressure changes, and that is going to cause the flow of gases. So basically, when the volume changes in the thoracic cavity, that's going to cause the pressure to change in the thoracic cavity, and then the air is always going to flow down its pressure gradient. So air is always going to go from an area of higher pressure to an area of lower pressure. So if the pressure in the lungs is lower than the pressure in the atmosphere, then air is going to get kind of sucked into the lungs. And if the pressure in the lungs is higher than the atmosphere, then the air is going to be pushed out into the atmosphere, and that's how we're going to get expiration. Before we get into the actual mechanics of breathing, we do need to talk a little bit about the relationship between volume and pressure. So the main thing to remember here is that if the volume of a container decreases, then the pressure of the gas inside that container is going to increase. So again, if volume decreases, then pressure increases. So this is going to be an inverse relationship. On the other hand, if the volume of a container increases, then the pressure inside that container is going to decrease. So the muscles that are involved in respiration are going to be the diaphragm and the two intercostal sets of muscles. The diaphragm is located underneath the rib cage, and when the diaphragm contracts, the diaphragm is going to move down, and that's going to pull the lungs along with it. The external intercostals, when those contract, they're going to cause the ribs to kind of rise up, and that is going to increase the volume of the thoracic cavity this way. So when we're looking at inspiration, getting air into the lungs, the first thing that's going to happen are those inspiratory muscles are going to contract. So the diaphragm is going to contract. That's going to pull the lungs down. The external intercostals are going to contract. That's going to pull the ribs up and out. And that's going to cause the volume of the thoracic cavity to increase. When the volume of the thoracic cavity increases, because the lungs are kind of stuck to the inside of the cavity because of that negative pressure, the lungs are going to be stretched, and the volume inside the lungs, the intrapulmonary volume, is going to increase. When that intrapulmonary volume increases, that is going to cause the intrapulmonary pressure to decrease, and it's going to drop to -1, so that's going to drop below atmospheric pressure. Because remember, if volume of a container increases, pressure is going to decrease. So when this intrapulmonary pressure drops, it's going to drop below atmospheric pressure. So that means that the pressure inside the lung cavity is going to be lower than the atmosphere. So that is going to cause the air to flow into the lungs. Once it flows into the lungs, that's going to equalize the pressure inside the lungs with the atmosphere, and it's going to be at 0 there. So again, the inspiratory muscles contract. The volume of the thoracic cavity and the lungs are going to increase. When that volume increases, the pressure inside the lungs is going to decrease, and that's going to allow air to flow down its pressure gradient into the lungs. So what we just looked at was a quiet inspiration, just a normal in and out breath, not straining to inhale, not exercising or doing anything like that. A forced inspiration is going to occur if you are vigorously exercising, if you have a lung disease and you're straining to get air in and out of your lungs. In that case, your accessory muscles are going to come into play. So basically any muscle that is attaching to the ribs and helping to pull the ribs up, helping to elevate the ribs, helping to increase the volume of that container and allow more air to get into that space. Expiration is pretty much just the exact opposite from inspiration. So what we're going to look at here is what we call a quiet expiration. So just a normal expiration, not forcing air out, not like you're blowing out birthday candles or anything like that. This is going to be a totally passive process, so no energy is going to be used for this. Basically, the muscles are just going to relax, so the diaphragm and the external intercostals are going to relax and go back to their original positions. That is going to cause the diaphragm to rise, the ribs are going to drop. That is going to cause the thoracic cavity volume to decrease. That causes the lungs to decrease, the size of the lungs, because the lungs want to get smaller if they can. So the thoracic cavity volume decreases, the intrapulmonary volume decreases. When this volume decreases, that causes the pressure to increase. When the pressure inside the lungs increases above atmospheric pressure, that's going to cause the air to flow down its gradient back out into the atmosphere. So again, the muscles are just going to relax. That's going to cause the volume of the cavity and the intrapulmonary volume to decrease. When the intrapulmonary volume decreases, that intrapulmonary pressure increases. And then the air is going to flow out of the lungs down its pressure gradient until it equalizes with the atmosphere.